girls and aimed at both increasing awareness of and combating sexually transmitted diseases, including HIV and AIDS. Programs have been introduced to combat sexually transmitted diseases, including HIV and AIDS, and these programs are dedicated to women and girls. These programs pay particular attention to women's reproductive roles and female subordination as factors that make women and girls vulnerable to sexually transmitted diseases, particularly HIV and AIDS. The program is mindful of gender issues and routinely, as part of a comprehensive system for treatment, care, and support, conducts assessments for gender-based violence and other gender-specific issues with direct links in a seamless system of referrals to sexual and reproductive health and family planning clinics. Antenatal care is free in the Commonwealth of the Bahamas. Antenatal women living with HIV are given antiretroviral medication at no charge to protect both mother and child. This has resulted in women with HIV who access these services delivering HIV-negative babies. No babies were born with HIV in 2015, 2019, and 2020. Contraceptive methods are available free of charge at the maternity ward and at public family planning clinics. We are proud to offer, as a part of a comprehensive listing of resources to combat STIs, including HIV, the female condom for more than 5 years and at no cost in our prevention program and clinics. As part of small group education activities and using peer educators and participatory methodologies, girls and women are shown how to use a condom, negotiate condom use with partners, and have greater control in sexual relationships. Measures have been introduced to ensure the participation of women as healthcare workers in the context of HIV and AIDS. Approximately 98% of STI, HIV, AIDS workers, including physicians, are women who are routinely given training in all aspects of STI, HIV, AIDS care, including stigma and discrimination and gender-related issues. The National HIV Strategic Plan 2016 to 2021 further addresses effective interventions for reaching youth, adolescent girls, and young women, and strengthening support for reducing vulnerabilities related to age and gender. Our response is strengthened by community-led civil society partnerships. We reaffirm our commitment to advancing gender equality and empowering women and girls in our HIV/AIDS response. Thank you.
Great, thank you so much to the distinguished panel, representative from the Bahamas. I will now turn it over to Brazil. If I could ask the representative from Brazil to keep it short as we are running against the clock. Thank you so much, and over to you, Brazil.
Thank you very much, Madam Chair. It is encouraging to acknowledge the impressive progress achieved globally in facing the HIV epidemic, especially in the last decade, which represent good reason for optimism. Brazil reiterates its commitment with the rights of people living with, at risk of, and affected by HIV, reaffirming that HIV response in our country is a state policy. In the context of our unified health system, a federal law has established the free-of-charge HIV treatment is available to all, safeguarding the basis of a full-fledged and self-sustainable program. In this context, our policy offers HIV prevention and care to all, but with specific strategies for different groups, whether to address the specificities of women's life cycle or the particular needs of key populations. All HIV services have specificities for women, such as the distribution of prevention supplies, access to timely diagnosis with rapid and conventional testing, especially in maternity hospitals, and access to treatment and clinical follow-up. There are also specificities regarding recommendations to prevent HIV vertical transmission and also for the health of pregnant women living with HIV, such as recommendations for the most adequate birth-delivery route, prophylaxis for newborns, as well as the supply for lactation inhibitor and milk formula until the child is 6 months old. In regards to HIV prevention, our health systems offer a wide range of methods: regular HIV testing, post-exposure prophylaxis, customized prenatal care for HIV-positive pregnant women, testing and treatment for other STIs, female or male condoms, treatment for all PL-HIV, and more recently, the pre-exposure prophylaxis. An example best practice on gender-based HIV interventions in Brazil is the implementation of PrEP since 2018, focused on priority populations such as transsexual women, commercial sex workers, women in serodifferential partners, as well as pregnant women and puerperal women at high risk for HIV. Moreover, drug use is considered an extra vulnerability to indicate PrEP use. Madam Chair, we must constantly innovate to keep the fight against HIV at the core of the international health agenda, specifically addressing the particular needs of the most vulnerable ones. We would appreciate if the panel could share additional innovative examples to promote the empowerment of women and girls in this regard. I thank you.
Wonderful. Thank you so much to the distinguished representative from Brazil and to all of the representatives from our member states for making those important remarks and the questions. I will now turn it back over to Shireen, our very qualified and talented moderator, to pose those questions to the panelists. Over to you, Shireen.
Very kind of you, Minister Gould. There's so much food for thought here. We could spend the rest of the day in this session. Sadly, schedules do not allow. As Minister Gould mentioned, we're really tight for time. We have exactly 5 minutes left for this lightning round of responses. I'm going to aggregate the questions. Essentially, we're talking about the structural barriers for women to access effective, comprehensive HIV prevention. We're talking about the ways forward in the broader context of gender equality. Some really interesting points here about the unequal burden, unequal division of unpaid labor in the home. We have had questions about ways to empower local partners and civil society organizations to overcome stigma and increase access to sexual and reproductive health services. Really fantastic points being raised. I'm sorry to put you on the spot, distinguished panelists, but could you, in response to this collection of really pressing questions, give us just one priority action, one recommendation in 1 minute of how to address some of these structural and societal barriers to change in the HIV response and gender equality? We'll begin with you, Phumzile. Or perhaps not. We will move to Stephen. Perhaps you could address this point. One recommendation, one priority action.
Thank you. Thank you for that. The priority action that I want to recommend is for us to really start to have a conversation that destigmatizes access to services for young people and has honest, frank conversations around sexual behavior and risk of sexual behavior, and think about how we can delay sexual debuts, offer full spectrum of sexual reproductive health services for young girls and adolescent young women, and include young boys in the sexual conversation by opening up and using schools as a critical entry point to be able to destigmatize and normalize these conversations around engagement in sex. Thank you very much.
Many thanks, Stephen, for the lightning response. Over to you, Phumzile. Right, we'll come back to Phumzile. Let's turn to Nadine. One priority action, one recommendation. You already gave us 7, I think, but please, one final thoughts on this.
Thank you so much. There's always other recommendations. It's very is the state. As states, we have the power in numbers. So we must put our weight of intergovernmental and multi-stakeholders alliances within the multilateral spaces behind the fight of achieving equality and agency for women and girls. So there's a very concrete actions in the multilateral world.
Terrific, thanks for that. Irene, over to you.
Thank you very much. I will say that it's critical to invest in adolescent girls and young women as change agents, decision makers, and as experts in their own right to conceptualize, lead, implement, and advance their own solutions and initiatives. This basically requires sustained, flexible, and accessible funding that works for adolescent girls and young women and not vice versa. Lastly, direct resources where change starts. Let it be from ground up, meaningful and sustained investment in women and young women and girls, women-led civil societies, including community-led initiatives, networks, and organizations is very key and critical to unleashing the power of movements and transforming harmful gender norms and building power with the realization of gender equality. Thank you.
Many thanks, Irene. We'll call on Phumzile. Final thoughts, Phumzile?
Hello?
Yes, excellent. Over to you.
Yeah, I did not hear the question.
We had many questions. This is really final thoughts. One recommendation, one priority action to really move ahead on equality for women and girls and access to HIV and SRHR services and information. One priority point.
Yeah. My priority is to address gender inequality at its depth and making sure that the prejudice that impact on girls and create the many problems that we have for women and girls, including HIV and AIDS, can be eliminated. It is important to target gender equality, especially to young people, in order to make sure that they grow up already rejecting to be discriminated against and standing and fighting for themselves. Thank you.
Many thanks. And on that inspiring note, I want to thank you all as panelists and also distinguished representatives from member states for your contributions. Today it's been a great pleasure to moderate the panel. And with that, I will hand over to the Honourable Minister.
Great. Well, thank you so much, Shireen, for doing such an exceptional job moderating today. And a big thank you to this very dynamic panel for, I think, adding depth and diversity to our discussion today. And I think we can all agree that this was an important and lively discussion to have. I personally am quite struck by the life and death difference it makes in the lives of the most vulnerable women and girls when they are part of leading transformative change. Once again, we have heard that women leaders know what needs to be addressed, but they need the power of all of us standing behind them, beside them, insisting on their rights, their voices to be central to how we work. This approach is particularly critical for the global HIV/AIDS response, considering how disproportionately women and girls in all their diversity are affected. And this must change. We are many partners now who stand with women leaders and organizations around the world to insist that the time is now for breaking down barriers to gender equality. And simply, we can't afford not to. We have heard from Dr. Gassman about change within a national government, from Irene, who is working with young women in Kenya to raise their voices, to demand their rights. And thank you, Irene, for talking about mental health. From Phumzile, the Executive Director of UN Women, about what they are doing to empower women and girls across multinational systems. And from Stephen, on behalf of the First Lady of Namibia, about how Namibia is addressing the needs of women and girls and the important role of education in achieving gender equality, but also in ensuring that women and girls have the support they need when it comes to the fight against HIV/AIDS. It is by listening to these voices and providing financing and moral support that we will continue to push the envelope. The AIDS epidemic calls for a global response to break down harmful norms so that women's lives are not defined by the barriers they did not set. We cannot allow the hard-won progress we have made on HIV over the last decade, and thank you, Phumzile, for reminding us about where we are today, to be lost because of the pandemic or any other reasons. We owe it to the key populations and others being left behind to give the battle against HIV/AIDS another surge of effort. They deserve nothing less than our greatest efforts. And it is only through high-level political commitment, continued financing for HIV/AIDS, and collective action that we will be able to meet our SDG commitment to end the AIDS epidemic by 2030. Let's remember what we heard today and consolidate our efforts to support feminist movements and leadership, as well as bodily autonomy and SRHR at the Generation Equality Forum in Paris later this month. In the meantime, thank you for joining this discussion. The high-level meeting on HIV has provided the opportunity to gain momentum as we continue to work toward ending the HIV/AIDS pandemic by 2030. Thank you, everyone.
Leaders right now comes from our unity and from our courage. The most unrealistic thing would be to imagine that we could overcome this global crisis without being bold, or that we could do it alone.
Уважаемый председатель, уважаемые делегаты, слушатели всего мира, я призываю созвать пятую тематическую дискуссионную группу совещания высокого уровня Генеральной Ассамблеи ООН, рассмотрение воздействия пандемии COVID-19 на меры по борьбе с ВИЧ-СПИДом, повышение эффективности мер по обеспечению готовности к пандемии. Позвольте представиться. Мазус Алексей, главный внештатный специалист по ВИЧ-инфекции Министерства здравоохранения Российской Федерации. Рад также представить модератора данной сессии, госпожу Туми Макхаба, предпринимателя и журналиста из Южной Африки, который поможет мне в ведении сегодняшней дискуссии. Приветствую также наших уважаемых участников дискуссии, которые присоединятся к нам дистанционно. Уважаемые коллеги, пандемия COVID-19 стала глобальным научно-медицинским, социально-экономическим и общественно-политическим вызовом современному человечеству. Противодействие COVID-19 потребовало от нас не только комплексных внутристрановых ответных мер, но и скоординированных глобальных усилий, нацеленных на стабилизацию ситуации во всем мире. Лидеры государств и руководители секторов здравоохранения были и являются основными акторами, принимающими решения в столь непростой, непредсказуемый период. Политическая воля стала важнейшим инструментом в противодействии COVID-19. Усилия стран, слившиеся воедино, позволили нам ответить на пандемию COVID-19 и взять ее под контроль. Данное мероприятие является одним из путей выражения политической воли в приверженности делу борьбы со СПИДом. Мы много раз слышали о разрушительном влиянии COVID-19 на противодействие распространению ВИЧ во многих странах. Это правда, так. COVID-19 ощутимо отодвинул мир в достижении глобальных целей по ВИЧ до 2030 года. Коронавирус застал нас врасплох. В первое время предоставление услуг по ВИЧ было затруднено во всем мире, что обострило проблему СПИДа. Карантинные и противоэпидемические меры привели к снижению охвата скринингом на ВИЧ-инфекцию практически во всех регионах мира, стали причиной нарушений в снабжении лиц, живущих с ВИЧ, жизненно необходимой антиретровирусной терапии. К тому же особенное влияние оказало временное перераспределение усилий медицинского персонала. Врачи-инфекционисты, в том числе работающие с ВИЧ-инфекцией, стали основной силой, задействованной в ответе на пандемию COVID-19. В эпоху COVID-19 как никогда важным стал фактор социальной и финансовой ответственности государства за здоровье своих граждан. Имеющееся перераспределение финансовых потоков, связанное с пандемией COVID-19, в дальнейшем не должно сказываться на реализации мер по противодействию ВИЧ-инфекции. И тем не менее, здесь на мероприятии столь высокого уровня мы должны смотреть на проблемы шире. Противодействие COVID-19 и ВИЧ — это не противоположные задачи, конкурирующие друг с другом. Это задачи, которые дополняют друг друга, стимулируют поиск новых подходов. Так, изоляция дома стала вынужденной нормой нашей жизни и позволила людям с новой точки зрения посмотреть на ценность семейных отношений, связей с близкими людьми. Это дает надежду на то, что при должных усилиях профилактические меры в отношении ВИЧ приобретут такое же общее признание их важности и необходимости и будут широко распространены. Нам трудно найти способы повсеместно восстановить и кратно нарастить объемы доступного тестирования, повысить эффективность лечения, в том числе с помощью разработки средства функционального излечения от ВИЧ. Убежден, глубоко уважаемые панелисты представят свой опыт и предложат идеи консолидации уроков, извлеченных из противодействия COVID-19 и ВИЧ. Здесь позвольте передать слово госпоже Тумби Макхаба, модератору данной дискуссии. Прошу вас, уважаемая госпожа Тумби Макхаба.
Mr. Mazuz, thank you so very much, and certainly some poignant remarks that you have made that will certainly steer our conversation in the right direction. Thank you once again. As he indicated as well, we are joined by a number of panelists to move our conversation forward. So I'm going to go ahead and introduce them, and then we're going to get straight into the discussion. We don't have a lot of time for that discussion, so we want to get straight to the talking. The first panelist whom I would like to introduce right now is the Acting Minister of Health of South Africa, Her Excellency Mamoloko Kubai Ngubane. Very warm welcome to you. Thank you for joining us. I'd also like to introduce Gail Smith, who is the coordinator of the Global COVID-19 Response and Health Security at the U.S. Department of State. Welcome to you. The Right Honourable Helen Clark, who really doesn't need any introduction, to be honest, is the co-chair of the Independent Panel on Pandemic Preparedness and Response. To you, welcome. And last but most certainly not least, I would like to welcome Gracia Violeta Ros Quiroga, who is the Bolivian Network of People Living with HIV/AIDS representative. To all the panelists, welcome. I hope you can hear me, and I'm looking forward to a very robust debate. If I can just ask that we try to keep our remarks as straight to the point as we possibly can. To the Acting Minister of Health from South Africa, I'd like to begin with you. In South Africa, the COVID mortality is sitting at around 3.4%. That has certainly been a challenging environment in terms of trying to ensure that we keep the pandemic under control in that country. However, in South Africa also, there has been a lot of progress made at the outset of the pandemic in trying to flatten the curve, so to speak. At the height of the HIV epidemic in South Africa, the death rate was also quite significantly high. We have seen those numbers tapering off in recent years. And there is no doubt that there would have been significant lessons that would have been learned from dealing with the HIV/AIDS epidemic. Infrastructure would obviously be one of the key ways in which that would have done. Can you give us a sense about how and what are the lessons that you've learned and how you've gone about applying those to how you've dealt with the COVID-19 pandemic in the country, please? The floor is yours.
I acknowledge the chairperson of the session, His Excellency Masous, the Chief External Expert on HIV Infection, Ministry of Health of Russia Federation, Ms. Mahabu, as your expert and proudly South African. Thank you very much, and to fellow panelists. I think lessons that we have learned from South Africa in dealing with the HIV pandemic and that we are utilizing as South Africa currently was firstly, the work that has been done in building capacity in terms of scientific research, labs. So around that, we've built capacity to be able to understand, and that's why you'd see that when we had to deal with the COVID-19 variant, it was scientists in our country that were able to pick up this variant and be able to tell us how it's performing. So it's those institutions, both in terms of private and public, also the community health infrastructure that we've been able to do, having primary healthcare facilities in communities, ward-based specifically, but also having community health workers who are able to assist us in terms of ensuring there's activism. The work that we've started to do in terms of SANEC, I see my former deputy president who used to be the chair, Ms. Phumzile Mlambo-Ngcuka, who used to be the chair of SANEC, what we call SANEC, which is a platform where we've been able to build and collaborate between public in terms of government, civil society, business, and various stakeholders, where we are able to work together to bring a response that is countrywide. So we've taken those lessons and we are utilizing them as we deal with the pandemic. So that's what we are able to see, and that's what has helped us in terms of continuously being able to see the work that we are doing currently. We have established what we call Solidarity Fund. This is a platform where we have private sector and public coming together to look at the funding method to respond to one of the things, PPEs, protective gears for us dealing with the pandemic. Also, currently with the vaccine rollout, we have platforms where it's what we call public-private partnership. We have business sector, we have labor, together with government, coming together to look at how can we source vaccines, how do we roll out in terms of logistics, what are the risks. So those lessons that we took from HIV and AIDS, dealing in terms of SANEC, it's what we are utilizing now in translating in responding to the pandemic. You were muted, I couldn't hear.
Yeah.
To me.
one of the things that one can take into consideration is looking at some of the interventions that you've outlined. But one cannot also overlook the fact that getting access to people, whether it be for testing or whether it be eventually for delivery, particularly in communities outside of urban areas, remains a significant challenge. How is the government looking to try to address that?
Thank you. I mean, we know that obviously based on our work across, one of the lessons that we are learning, for example, now with the vaccine, we've now registered quite a number in terms of Sisonke program for the healthcare practitioners. We're now registering the senior citizens. And one of the lessons that we've got to be able to do and what we are starting to focus on is to utilize our infrastructure. For example, we've got our independent electoral commission that exists across the whole country. So in terms of our wards, whether they are in remote areas, urban areas, they actually are able to operate within the schools, within the churches, within various. One of the provinces that we have now, which is leading in terms of registration for the vaccine, is Limpopo province, which is the rural province. And this we are seeing because we've seen the churches come forth to say we'll utilize our centers as part of supporting government as centers for registration for the vaccine, but also in terms of providing the vaccine. We've seen healthcare workers going into house to house, what we would call door to door, because we've learned through other mechanisms of working to be able to register, and we'll be rolling out that completely across the country.
Okay, Minister, thank you very much. If I can ask you to remain on standby for us, I'd like to now move on to Gail Smith, who, of course, is the coordinator of the Global COVID-19 Response and Health Security at the U.S. Department of State. Gail, if I can ask you the following. Now, COVID-19 has no doubt highlighted the need for countries to be more prepared, and there also needs to be a better response, either as individual countries, but also more collectively. Many obviously decried the response, the initial response in the US to the COVID-19 pandemic. But what has been interesting is that we have seen improved rollouts, not just in the context of COVID, but also in the context of HIV/AIDS. This huge decline of 8% since 2015 in the number of incidents of HIV is certainly something that one can take note of. Looking at the responses, what needs to happen differently to ensure that in the future, when confronted with the next pandemic, that response is more immediate and more effective?
Thanks very much for the question, and I'm honored to be here with you today. I do want to just take a minute of pause to mark 40 years and honor all of the people who are no longer with us, but celebrate those many lives of people living with HIV, and thank everybody for everything you've done. Look, I think your question is a really, really important one, and we've learned a number of things from this pandemic. One is that having foundations like PEPFAR and what we've been able to do and adapt to quickly respond to this pandemic is one of the answers that we have. Our team has been able to adapt so that care is made more available more quickly to people where they are, that they can get treatment allocations over a period of time so that they are able to sustain their treatment even during lockdowns and so on. So I think we've got to build on those foundations. But I think there are other key things we need to do. Again, building on the foundations that many of us have contributed to during the course of the HIV/AIDS pandemic or epidemic. And that means, for example, strengthening health systems, building the capacity of countries to prevent, detect, and respond to global health threats like HIV and AIDS. Build on that foundation to make sure there are no holes in the net. We learned this also from Ebola. So that's one very key thing we're going to need to do. And the world is going to need to mobilize the financing and the support that we have done for HIV in order to get there. And frankly, it'll serve us with all kinds of viruses, including HIV. The second is to work multilaterally and internationally. And I'm pleased that the United States rejoined the World Health Organization on day one of this administration. We've joined Act A, where we're building on the great work of the Global Fund. And we are working with our partners now in the lead up to the G Summit to make a very big move on vaccinations for the world. And I think that international collective effort makes a huge, huge difference. I think the third and the last is to organize and mobilize communities. We know from our work on HIV and AIDS that it is much more than just going to people and being an instrument to deliver. It is organizing, mobilizing, building on local culture, local experience, local institutions to have that strong foundation so that no one is left behind. So I think if we do all of those things, but add one last ingredient, and that is staying power, I think we can do it.
I keep getting muted, and it's not even by me.
Yes, I wondered there.
Sorry about that, Gail. With that in mind, I think one of the things that's quite interesting about the comments that you've just made is this notion of community response, not just in terms of engagement, but adaptability. In other words, communities are not homogenous around the world. So how one may do it in one part of the country may be different. And to what extent is it possible to integrate that kind of sensitivity around community functioning in crafting a better response and a more effective response?
Well, I think it's not easy, but I think it's necessary. And again, if we look at what the world has done on HIV and AIDS, that's been a necessary ingredient, right? Because people are not affected uniformly. They're different populations. They're from different backgrounds. They work in different fields. We've got the whole dimension of stigma and disenfranchised people. And we've had to learn to tailor our programming to take all of that diversity into account. That's, again, one of the strongest pieces of the foundation that we need to build. And I think it's true everywhere. So I think, again, what we've got to do is look at all the investments that many of us have made over the years in global health. And I don't just mean donors. I'm very proud of what the United States has done, but countries all over the world have made increased investments in strengthening their health systems. We've got to look at that foundation, figure out where we need to tweak it, what the strengths are, and use that as the way to build up to make sure that we not only can prepare for epidemics like HIV or pandemics like COVID-19, but that we can prevent them, that we can detect these viruses, and that we can respond quickly and immediately, obviously to save more lives and secure a better future for everybody.
All right, Gail, I'm going to ask you also to remain on standby because that is actually a really good segue to welcome our next panelist, the Right Honourable Helen Clark. Now, Helen, having looked at the initial feedback from the report that you worked or helped craft, what has been really, really interesting is that you have been quite scathing of the way in which, not just at the beginning of the COVID-19 pandemic, countries responded, many failing to respond or failing to heed the guidance of the World Health Organization. But your report certainly doesn't seem to suggest that there has been significant or sufficient action in terms of having a more and better coordinated response. Would that be accurate?
Well, we have been critical of the lack of preparedness that the world entered into this pandemic with. We feel that the pandemic was preventable, but countries needed to have, really good preparedness plans, and they needed to be prepared to act very quickly when the World Health Organization Director General declared the public health emergency of international concern. Most did not do so. And then by the time the pandemic was beginning to run out of control, most noticeably in March, there was then a scramble for everything, a scramble for the personal protective equipment, for the diagnostics, for whatever drugs might work. And now we're seeing the same sort of scramble with the vaccines, are we not? And one of the great concerns is that we will end up with a two-tier world where some have access to vaccines and some don't. So getting everybody to work collaboratively on that problem is extremely important, and we're very much looking to the G7 in the coming days in the United Kingdom to see how much they will rally to redistribute surplus vaccine stock, which high-income countries have, back into the coordinated pool, COVAX, which has been struggling to get the number of vaccines required to even make a decent start for the low and middle income countries. So coordination's everything. We haven't had enough of it. The multilateral spirit has been, somewhat limp, shall we say, in recent years. I think the Biden administration gives a fresh impetus, really, to getting things back on course, particularly around something which should unite us, like the response to a pandemic. But our panel did make a number of recommendations for new institutional arrangements to bed in cooperation and coordination for the longer term.
Let's just take a closer look. One of the challenges that many countries at the outset of the pandemic kept expressing was that they needed to have the autonomy and the ability as states within themselves to try to assess how better to respond. The flip side speaks to what you've just suggested, to say, well, sometimes it doesn't always work in that way. How does one then find the middle ground that actually serves all in a way that doesn't impose particular views on others?
Well, I don't think it's about imposing views. I think it's about all countries heeding recommendations for best practice on how you respond to a pandemic. And very relevant to the theme of this high-level meeting on AIDS is we need to take on board the lessons of what has worked with HIV. The HIV response began to improve when communities were engaged in the response, particularly the communities of those living with HIV. Now, when our panel commissioned a study of a range of responses to COVID, a 28-country study, we observed that a number of factors were very important in having a more successful response. Leadership was obviously critical, health system capacity, but also the willingness to engage with communities and let the community leaders come to the fore and show what they could do. It's hard to have a successful response of the community sitting there sullen and not wanting to cooperate because it hasn't been engaged and hasn't got the information it needs. So having that, that two-way relationship between authorities and people is pretty important in effective responses.
All right, Helen, if you can also remain on standby for us, because once again, a really good segue to ask our next panelist to share her views with us. Gracia Violeta Ros Quiroga, who represents the Bolivian network of people living with HIV/AIDS. Another welcome to you. Low and income countries we have seen have taken or have suffered particularly when it comes to dealing with COVID-19, not just from the vaccine debate, because that's, I think, a conversation for another panel and maybe even another day, but looking at the way in which dealing with the COVID-19 pandemic has impacted the delivery and treatment in relation to HIV/AIDS. Low-income countries, low-income and middle-income countries have been the ones hardest hit in that regard. From a grassroots perspective, how does one better ensure that treatment and management of disease is not negatively affected because one is dealing with another breakout of a pandemic or epidemic?
Gracias por tu pregunta. Te voy a responder lo que me preguntaste, pero primero quiero dar alguna información sobre cómo la pandemia de COVID ha estado afectando a América Latina. Yo les hablo desde Bolivia, un país de ingresos medios, en desarrollo y sin acceso al mar. Aquí la pandemia de COVID-19 está teniendo un impacto desastroso. El 1 de junio de 2021, América Latina y el Caribe ya contabilizaban 1 millón de casos nuevos cada 6 días. Durante mayo de 2021 contribuimos con el 35% de los nuevos casos, aunque solo representamos el 8% de la población.
Can I just interrupt you? Sorry, very briefly. I'm unfortunately don't speak Spanish, and we're not having interpretation that I can hear. So if I could perhaps just request that they activate the translation, and then I could ask you to please continue. If you could just bear with us for 1 second, so I can get the go. Yeah, I have selected the English interpretation, but I'm still not getting the interpretation coming through on my audio. All right, it seems that we're not the only ones. So can I just ask perhaps that we try to sort out the interpretation for Gracia, because I think it would be important for everybody to be able to hear her inputs in these remarks. I'm going to go back to one of our other panelists, if you don't mind, Gracia, very, very quickly, and then I will certainly come back to you, and I will give you the time again to make your intervention. I just want to make sure that everybody's able to hear you.
Okay.
Thank you very much. So if I can then come back to you for a moment then, Gail. I was looking forward to hearing what Gracia has to say, particularly from a community intervention perspective. But I'd like you to elaborate a little bit on that suggestion that you had made earlier. You indicated that it's one thing for us to say that we can engage communities. It's not an easy thing to do. So what would then be step one of making sure that we do that, and we do that accurately and as well as possible?
You mean engaging communities?
Yes, and ensuring that the solutions are actually structured in such a way that they are effective in specific communities or relevant communities.
Yeah, I think it requires a few things if we really want to do it well. One is obviously person-to-person connections, and so it means working directly with local communities, with local civil society organizations, and with local administrations, because in a lot of cases we've got good and effective healthcare workers and others on the ground. So I think having those conversations at that level. I think we've also now got a wealth of analysis and data that tells us some things that we can factor in, because as a world we've got much more experience with this. So I think looking at what has worked and what hasn't worked in other situations is the second way to make sure that works. And the third is something that I think across the development spectrum, people agree is a very important tool, and that is the kind of evaluation where you make an intervention, you run a program, and then you go back and with local people, you take a look at what worked and what didn't, and then adapt and reconfigure based on that. It takes more time, it yields better results.
Yeah, that's precisely what was going to be my question, is the time factor, because that solution does require that one is more deliberate and therefore oftentimes a little bit slower in order to ensure that you're able to take those things into account. But let me try to go back to Gracia and see if we have her interpretation back up again. Gracia, I'm going to try to come back to you. Hopefully we'll now be able to hear you better. If I can just ask you to begin once again in responding to the question as to how we can make sure that the treatments are better managed and effective, please.
Gracias. Te voy a responder a la pregunta al final de mi intervención. Tengo una intervención preparada y es importante que la haga porque es como un encargo de la sociedad civil de América Latina, considerando que soy la única oradora de América Latina. Bueno, en mi caso, yo les estoy hablando desde Bolivia, un país de ingresos medios, en desarrollo y sin acceso al mar. Aquí, como en toda la región, la pandemia de COVID-19 está teniendo un impacto desastroso. El 1 de junio de 2021, América Latina y el Caribe contabilizábamos 1 millón de casos nuevos cada 6 días. Durante mayo de 2021 contribuimos con el 35% de los nuevos casos, aunque solo representamos el 8% de la población mundial. Ya hemos enterrado a 1 millón de muertos y es casi exacto decir que nos estamos convirtiendo en el nuevo epicentro de la pandemia de COVID-19. Lamentablemente en América Latina conocemos la muerte. Esta es una de las regiones más diversas, desiguales y violentas del mundo, especialmente en relación a la violencia de género y los crímenes de odio provocados por la homofobia, la transfobia y la misoginia. América Latina ya había sido dejada atrás en los espacios globales de discusión de VIH. Ahora está desapareciendo en la conjunción de una crisis multidimensional. La falta de políticas públicas sostenibles en VIH se deben a los prejuicios contra aquellas poblaciones de las que nadie quiere hablar, pero que ahora voy a mencionar. Las personas que vivimos con VIH, las mujeres, las niñas, los hombres gays, las mujeres transgénero, las trabajadoras sexuales, jóvenes, migrantes, personas que usan drogas, personas con discapacidad, personas privadas de su libertad, indígenas y afrodescendientes. Todos nosotros somos poblaciones que ya vivíamos en situaciones de exclusión y desigualdad. Por eso la pandemia de COVID-19 encontró un terreno fértil aquí. Con esta pandemia se han evaluado los sistemas de salud y muchos han fallado. La preparación para una pandemia es responsabilidad de los estados. Sin embargo, las comunidades que vivimos con VIH y afectadas estamos respondiendo porque queremos vivir o sobrevivir. Como hicimos con el VIH hace años, estamos asumiendo tareas que le corresponden a nuestros gobiernos. Sin acceso a los recursos, hemos demostrado que la respuesta a una pandemia va a ser eficaz solamente si se coloca a las personas en el centro de las políticas públicas. Nosotros somos una prueba viviente que una pandemia no acaba con medicamentos y vacunas, sino con programas de protección social, con justicia, con equidad en la distribución de la riqueza y mediante una lucha directa contra la pobreza, la violencia y las desigualdades. Yo soy parte del movimiento latinoamericano y del Caribe de Mujeres Positivas y a través de una estrategia regional movilizamos 850 voluntarias en 17 países de la región, logrando entregar más de 3,000 canastas de alimentos, facilitando el acceso a los medicamentos antirretrovirales y el apoyo psicológico y emocional. Como esta iniciativa hay muchas otras en América Latina de las que podemos aprender y a las cuales deberíamos apoyar. Ayer mismo estuve escuchando una charla de mujeres con VIH de Venezuela que están luchando en condiciones muy precarias, no solamente desde el inicio de COVID, sino desde hace mucho tiempo atrás. La estrategia global del SIDA enfatiza la necesidad de abordar las desigualdades e inequidades, y si mantenemos ese espíritu en la declaración de compromiso y cumplimos con lo que se acordó en esta reunión de alto nivel, solo entonces vamos a empezar a ver la oportunidad en medio de esta crisis, y eso va a requerir acciones inmediatas. Para América Latina, el acceso a la cura y la vacuna de VIH es urgente. Nosotros no entendemos cómo después de 40 años de esta epidemia todavía no se ha podido desarrollar una vacuna y una cura. Como sucedió con los medicamentos contra el VIH, los perversos juegos de poder de la industria farmacéutica y los países hegemónicos nos están dejando a los países pequeños y pobres sin acceso a las vacunas y los suministros de prevención. A fines de mayo de 2021, menos del 4% de la población de América Latina y el Caribe había sido completamente vacunada contra COVID-19. Si seguimos de esta manera, seguramente vamos a exacerbar la crisis y provocar la desaparición de regiones como América Latina. Las personas que vivimos con VIH y comunidades afectadas de América Latina hemos preparado un posicionamiento político donde pedimos que no haya otra reunión de alto nivel donde se cumple todo, pero se incumple todo. Los retrocesos en VIH que se han provocado con la pandemia de COVID no hubieran sido tan devastadores si tuviéramos políticas sostenibles. La pobreza no se habría exacerbado a tal nivel si tendríamos medidas de protección social y no hubiera muerto tanta gente por causa de la violencia de género y la violencia política si tuviéramos leyes efectivas que protejan los derechos humanos. Y por último, quisiéramos reflexionar especialmente sobre las discusiones en esta reunión de alto nivel, el concepto de soberanía nacional. Nuestra comunidad nunca vio un uso tan diverso de este concepto desde diferentes enfoques, incluyendo el económico, el científico y el político. Y con mucho respeto queremos decir que el uso indefinido de estos conceptos puede resultar en un arma de doble filo. Para nosotros, la autonomía soberana de un país debería ser utilizada para adoptar leyes y políticas que eliminen las tremendas desigualdades, que protejan los derechos humanos y busquen nuestro bienestar colectivo. Es por estas razones que las comunidades de América Latina y el Caribe hacemos un llamado urgente a los estados y les pedimos que, por favor, salven el capital humano de nuestros países, cumplan su palabra e implementen los compromisos de la declaración política lo antes posible, porque sinceramente no hay mucho tiempo que perder. Hay muchas personas que siguen muriendo en esta región. Muchísimas gracias.
Violeta, thank you very much. That went really quickly in terms of all our panelists, and we've exceeded our time for now. So for the time being, I would like to hand the floor back to the chair, Mr. Alexei Mazuz, to give the member states from the floor an opportunity to intervene. Mr. Chair, the floor is yours.
Уважаемая госпожа Туми Маккаба, уважаемые панелисты, благодарю вас за ваши доклады. Я хочу передать слово залу для комментариев. Если вы хотите выступить, пожалуйста, нажмите кнопку на микрофоне. Позвольте напомнить государствам-членам о соблюдении необходимого регламента 2 минуты при участии в интерактивном сегменте дискуссионной. группы. После вопросов из зала мы также заслушаем в виде обращения двух уважаемых спикеров, доктора Жужанны Якоб, заместителя генерального директора Всемирной организации здравоохранения, и доктора Джона Нактеккасона, прошу прощения, директора CDC Африка. А слово предоставляется Индонезии. Пожалуйста.
Thank you, Mr. Chair. We thank all panelists for eye-opening presentations on the impact of COVID-19 pandemic to the HIV response. The government of Indonesia is committed to accelerating our efforts to end HIV and AIDS in 2030 by providing lifelong safe, effective and affordable HIV treatment. We also ensure that local communities are engaged and involved to address this issue together. Nevertheless, the COVID-19 has now become a major public health challenge. This new global pandemic complicates our works to respond HIV and AIDS. Recently, AIDS is referred to be the so-called the forgotten pandemic. On that note, my delegation concludes with a couple of questions. First, how can we learn from the massive COVID-19 response around the world in order to construct a similar global solidarity to end HIV and AIDS by 2030? Second, how do you see the socio-cultural identity in local communities to build a global solidarity on HIV response in the midst of COVID-19 pandemic? I thank you.
Большое вам спасибо. Слово предоставляется представителю Бразилии. Пожалуйста.
Thank you very much, Mr. Chair. I thank all panelists for their presentations. COVID-19 has had a major impact on lives and livelihoods everywhere. There is no different for the HIV response. Brazil reiterates its sympathies for those who lost their loved ones. We also express our gratitude and solidarity to those who are at the forefront of the fight against the virus. The COVID-19 pandemic has arisen as an unprecedented global emergency with an enormous impact on HIV prevention and care. Even in this scenario, not only has Brazil been able to maintain the treatment to more than 700,000 people living with HIV, but it also guaranteed the supply chain for prevention products, including PrEP and PEP. There is no doubt that our 3 decades constitutional commitment to universal health access has been a fundamental tool in coping with the COVID-19 pandemic. Moreover, the Ministry of Health of Brazil, in line with our tradition of solidarity, could continue to engage in cooperation efforts with our partners in Latin America and the Caribbean by means of ARV donations despite our domestic challenges. Mr. Chair, at this juncture, in the context of a new political declaration on HIV and AIDS, it is time to acknowledge this impressive progress achieved globally. But it is also time to remember that there is still much to be done if we want to put an end to the AIDS epidemic by 2030. We should redouble our political commitment and efforts to ensure health for all. This is even more necessary as COVID-19 has slowed down the pace towards the achievement of the SDG targets. In this regard, we would appreciate if the panelists could identify one main innovative way to cooperate with the scientific community and the private sector, lessons learned from the COVID-19 response, especially from the development of a COVID vaccine that could contribute to ending AIDS by 2030. I thank you.
Большое вам спасибо за выступление. Я передаю слово представителю Алжира. Пожалуйста.
Thank you so much, Your Excellency, for giving me the floor. COVID-19 pandemic has had a significant impact on health systems and particularly on HIV care services. It resulted in some situations in the enclosure of HIV facilities and disruption of antiretroviral supply, further placing people living with HIV at an increased risk. In many developing countries, including mine, the current health pandemic has isolated many people living with HIV, and in some situations, forcing them not to consult nor to recover their treatments. This is also valid for people living with HIV who found themselves blocked in other countries and not being able to access to the necessary health care services needed. In this regard, we do believe that innovative policies and structural changes introduced in the context of COVID-19 pandemic need to be applied in the context of HIV. Reaching the universal health coverage could be a huge step that will make people living with HIV easier and safer and help the international community stop the spread of AIDS by 2030. I would like to address the following question. What are the lessons learned from the current pandemic that will help all involved actors provide continuous care and treatment and for people living with HIV in future pandemics and leave no one behind in the process? Mr. Chair, COVID-19 remains a crisis that threatens to undo the gains of HIV response, but in the meantime, it can constitute a real opportunity to raise innovative funding sources. We need to insist on sustainability, solidarity, and multilateral collaboration to support social cohesion and reduce inequalities. We do not have to lose sight that an HIV vaccine remains the priority. In this regard, how can we better ensure that the flexibilities that we had for COVID-19 vaccine are applied and strengthened in the response to HIV/AIDS? And I thank you.
Спасибо. Слово предоставляется представителю Таиланда. Пожалуйста.
Thank you, Mr. Chair, and also thank you to the presentations from the panel and the moderator. Thailand believes that during the COVID-19 pandemic, one of the most important but challenging aspects is the continuity of other health services, including HIV-related services, which is a key part of achieving universal health coverage. Let us share some of our reflections. In our case, Thailand relies on our existing partnership with the networks of people living with HIV and the civil society, coupled with using of technology. Some key examples include the adaptation of key population-led intervention at the community level, such as extending PrEP prescriptions, arranging telehealth consultations, and promoting self-sampling of sexually transmitted diseases, developing an online crisis response system for reporting of HIV-related human rights violation, and supporting mobile laboratory services and postal delivery of medicines. Thailand believes that we can build on our good efforts in both HIV and COVID-19 responses to strengthen health security, pandemic preparedness, and resilience in the bigger picture. We can use the guidance of the report of the Independent Panel for Pandemic Preparedness and Response to identify gaps and opportunities. Thailand, as current chair of the Global Health Security Agenda, underscores the importance of building of capacities to prepare and respond to pandemics, which needs to be matched with the investment needed. We also welcome the recent adoption of the World Health Assembly decision, which gives us the opportunity to review and strengthen multilateral health architecture, including by considering the possibility of having a pandemic treaty. Thailand remains committed to work with all other countries and with stakeholders in our endeavor to ensure the right to highest attainable standard of health, as well as the achievement of the SDG, in particular SDG 3. I thank you.
Большое вам спасибо. Слово предоставляется представителю Марокко. Пожалуйста.
Thank you, Mr. Chair, for giving me the floor and for your introductory remarks. Sincere thanks also to our esteemed panelists for the rich and enlightening intervention during this important thematic panel. Morocco regrets that the COVID-19 pandemic has exacerbated existing inequalities, created additional setbacks and pushed the AIDS and HIV response, especially access to medicines, treatment, and diagnostics. The pandemic has unfortunately exposed many developing countries, especially African countries, to the sad reality of underinvestment in public health, health systems, and other essential public services that are important for pandemic preparedness. On a positive note, however, many national responses to COVID-19 pandemic have demonstrated the potential and urgency for greater investment in pandemic responses and the importance of increasing investment for public health systems, including responses to HIV, tuberculosis, hepatitis, and sexually transmitted infections. In this regard, allow me to make a comment and pose a question. First, I'd like to commend the role played by multi-stakeholders, partnerships, and initiatives. And in this regard, I pay a special tribute to the Global Alliance for Vaccines and Immunizations, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and to UNAID for their important role in improving and strengthening health system, a fact that contributes strongly to member states' efforts to get on track and end AIDS by 2030. My question is the following. What are the best steps to follow or to undertake and accelerate integration of HIV services into universal health coverage so as to build better in a more equitable and inclusive manner from COVID-19 context and to enhance HIV pandemic response, especially in humanitarian settings, that ensure equal access, prevention, and treatment and care to migrants, refugees, and internally displaced persons. I thank you, Mr. President.
Спасибо. Предоставляю слово представителю Багам. Пожалуйста.
Thank you to the esteemed panel for presenting us with such valuable insight onto this very important issue. There is no doubt that we all know the magnitude and the damage COVID-19 has done since it emerged and initiated a global pandemic. There are key similarities between the COVID-19 pandemic and the HIV epidemic, and that must be acknowledged so that we can effectively respond. HIV and COVID-19 are or were at one time novel viruses, and gaps in knowledge existed or still do exist in the virology, transmission, treatment, and prevention modalities. Stigma and discrimination, fear, and panic ensued because of some of these factors, and this is important because it impacts outcomes. A people-centered approach, knowledge management, and reducing inequalities will facilitate better outcomes. Commodities and innovative treatments exist for both infections. In the case of COVID-19, antiviral drugs such as remdesivir and monoclonal antibodies for treatment and prevention exist. Vaccines exist against COVID-19. Gaps also exist in the global access to and the availability of these commodities, and equity is needed. Global cooperation, collaboration, and sharing is key to see major improvements in both of these issues. My next comment is specific vulnerabilities exist in terms of COVID-19 on the HIV epidemic and HIV services itself, including disruptions in care and health services, HIV testing, routine and other relevant services. Trade and travel restrictions potentially interrupt supplies of medicines, goods, and services. Stigma and discrimination and mental health issues may rear up. Telemedicine is helpful, but gaps still remain for the most vulnerable persons, including those with limited support, those experiencing and at risk for intimate partner violence, and who have other vulnerabilities. In the Bahamas, we learned valuable lessons over time in our work with HIV and AIDS. We offer people-centered services in an aim to leave no one behind. We are pleased to report that we continue to provide HIV prevention, treatment, and support services uninterrupted in the COVID-19 pandemic. Testing was impacted but did not stop, and HIV treatment and medicines continue to be dispensed at levels comparable to pre-COVID-19 pandemic dispensing. Mental health was bolstered by links to relevant services. Telemedicine was deployed when acceptable and appropriate for use. There is more to do. We must reprogram in the aftermath, and we are committed to the same in our incoming HIV/AIDS strategic planning. We must see equity for all people and countries to ensure high-quality services, commodities, cutting-edge innovations, vaccines, and the best tools to fight pandemics such as COVID-19 and the epidemics such as HIV. In this regard, our question to the panel is, how can people-centered services be further strengthened through access to technology in a sustainable manner?
Я вынужден прервать ваше выступление. Большое спасибо. Передаю слово представителю Мексики. Пожалуйста.
Muchas gracias, estimado presidente. Quiero agradecer a las panelistas por sus enriquecidas intervenciones y en especial a la señora Violeta Ross por su impactante intervención que refleja las grandes demandas y necesidades que nuestra región enfrenta. Las emergencias sanitarias, crisis humanitarias, desastres naturales, las situaciones de conflicto y el desplazamiento exacerban las vulnerabilidades preexistentes. A más de un año del inicio de la pandemia del COVID es innegable el impacto negativo que ha producido en la respuesta global a la pandemia del VIH, ya que ha requerido una reestructuración de los servicios de salud, poniendo en riesgo las estrategias de salud sexual, prevención y continuidad de la atención de las personas que viven con VIH. Si bien la pandemia por el COVID-19 ha hecho más evidente las desigualdades, la falta de recursos humanos y materiales, la fragmentación de los sistemas de salud e inequidad de acceso, también ha subrayado la importancia de las lecciones de la respuesta del VIH, como la necesidad de incluir a las comunidades para la instrumentación de los mecanismos de prevención, control y generación de sistemas resilientes, la posibilidad de la atención a la salud y coordinación remota de los servicios, la necesidad de coordinación y cooperación intersectorial e internacional y la importancia de generar información para la toma de decisiones. Ahora es tiempo de pasar del discurso de lecciones aprendidas a la implementación de sistemas que permitan responder mejor a las emergencias que seguramente enfrentaremos, generar mecanismos de preparación y respuesta adaptables. La capacitación e inclusión de líderes comunitarios y poblaciones clave en este proceso resulta esencial. El no dejar a nadie atrás en la respuesta al VIH también significa refrendar el interés genuino de disminuir las brechas de desigualdad, el luchar por naciones inclusivas, seguras, resilientes y sostenibles que protejan la salud de todas las personas y en especial velen por los más vulnerables de manera permanente y en especial durante las emergencias. Nuestra pregunta a las distinguidas panelistas es la siguiente. ¿Cómo aseguramos que las señales y advertencias sobre futuras crisis y pandemias sean realmente atendidas y no queden simplemente en alertas? Muchas gracias.
Большое вам спасибо. Спасибо всем участникам дискуссии. Я передаю слово уважаемой Туме Макхаба. Пожалуйста.
Thank you very much, Mr. Chair. Unfortunately, I didn't hear the end of your remarks, but I'm assuming that you were handing the floor back to me. Thank you very much for that. And also, of course, thank you very much to the members in the room. We will be posing those questions to the panelists in just a moment. But before we do that, I would like to draw your attention to a pre-recorded intervention that we have from Dr. Tedros Adhanom Ghebreyesus, who, of course, is the Director General of the World Health Organization, for this pre-recorded intervention.
Excellencies, honorable ministers, colleagues and friends, good morning, good afternoon, and good evening. I would like to thank the President of the General Assembly and the co-facilitators, Australia and Namibia, for convening this important high-level meeting. My opening message is a simple one. We must all redouble our efforts to end AIDS as a public health threat by 2030. Yet, while my opening message is a simple one, the response required from all of us is not. WHO is deeply concerned about the impact of COVID-19 on the global response to HIV. Disruptions to life-saving commodities and services could be potentially result in as many as 500,000 excess deaths globally. And modeling confirms that benefits of continuing to provide life-saving HIV services outweigh the risk of COVID-19 transmission and potential death by 100 to 1. These disruptions hit us at a critical moment, as progress in the global response to HIV had already stalled. And progress continues to stall because HIV prevention and testing services are not reaching the groups that need them most. Men who have sex with men, sex workers, transgender people, people who inject drugs, and prisoners are particularly vulnerable to HIV and frequently lack adequate access to HIV services. In the context of COVID-19, we must make an extra effort to ensure they access all the HIV services they need. It is vital that we ensure universal access to quality health services, particularly for the most vulnerable. Access to services for vulnerable groups and groups at higher risk must be expanded through stronger community engagement, improved service delivery, and tackling stigma and discrimination. I thank you.
And of course, that was the Deputy Director of the World Health Organization, Ms. Shoujana Jacob. Apologies for that. I guess I was really keen to see the doctor speaking as well. So, Ms. Jacob, my apologies. And we will then move on to the next pre-recorded message that we will be sharing with you. This intervention comes from Dr. John Nkenga Song, who is the Director of the Africa Center for Disease Control.
Greetings from the Africa Centers for Disease Control and Prevention in Addis Ababa, Ethiopia. I'm going to be discussing with you the emerging role of regional and continental public health bodies in coordinating and negotiating a quick response in a global pandemic. Since the start of the pandemic, that is the COVID pandemic, the African Union's response has been driven by the principles of cooperation, coordination, collaboration, and communication, using the whole of Africa approach. Through this continental approach, we have managed to quickly and collectively respond to the pandemic, ensuring that no country, no African is left behind. The African Joint Continental Strategy for COVID-19 Response, which was launched in early 2020 under the leadership of the chairperson of the African Union Commission, His Excellency President Cyril Ramaphosa, the President of South Africa, guides the continental response to the pandemic. As of 17 May 2021, 47 member states have started vaccinating priority populations with over 24.2 million people vaccinated, and 5.2 million people in 9 member states receiving their second doses of the vaccines. The successes achieved clearly demonstrate the need and emerging role of regional and continental bodies in preparing for and responding to future disease threats and potential pandemics. African leaders must strengthen continental and regional public health agencies to protect their population from health threats, as well as economic and security threats. COVID-19 impacts HIV in several ways, including importance of continuity of services and accessibility of testing, treatment for all, particularly vulnerability to COVID-19 pandemic. Africa has the largest burden of endemic diseases in the world, and COVID-19 pandemic could abolish decades of progress in the fight against these diseases by disrupting healthcare provision and access to medications. In the short to medium term, the pandemic has led to disruption in numerous public health services, such as HIV testing and treatment. Anecdotal evidence also showed that the excess non-COVID-19 deaths resulting from service interruption may be greater than COVID-19 related deaths. Without prevention services, such as testing, people cannot know their HIV status or access treatment, and the incidence rate of HIV in this community is at risk of increasing. Further, the complete shift of attention of governments and other public health actors towards the COVID-19 response, coupled with the complacency towards the HIV epidemic, is a cause of concern and needs immediate attention. There is also a need for designing alternative strategies and innovative approaches, such as telemedicine, for continuing care. I thank you.
Dr. Ngenga Song for that intervention, and also from the others that we have received from the floor, and also from the Deputy Director of the World Health Organization. There was a lot said in those interventions, and certainly a lot of questions raised too. I know we don't have a lot of time left in terms of our discussion, but I'd like to go back to the panelists to get some feedback from them around precisely how they believe we will be able to move forward. One of the key notes that was made was this question around having adaptable strategies and ensuring that whatever strategy is developed, that it will actually be able to work, not just for one community, but one can tailor it for others. Perhaps if I could come back to you, Madam Minister, if you can give us input on how South Africa would view trying to craft such interventions.
Okay, I think I'm back. I was waiting for the screen. Am I audible to me?
Yes, you are.
Okay, thank you very much. I think part of the conversations that I think it's very important, as we initially alluded, yes, the strategies that we involve or we embark on across the countries, or even in a country, to be able to involve, I think, the community work that is being raised. Part of what is important is to remember that as we do this work, we need to be able to bring the communities themselves. So in every society, we have various stakeholders. In South Africa, for example, I'd say you'd have your religious sector, your traditional leaders, and if you have a strategy in terms of involving them in the rollout, for example, if you are to deal with HIV and AIDS, one of the challenges that we would have had previously was, or even what we are seeing now, is as we deal with COVID, because of the lockdowns and other things, you'd have seen the reduction in terms of people accessing the medication. So you'd need to go back to those structures, community health care workers, who are able to assist you to respond to those challenges and be able to get you to get them, everybody to get their medication, because they shouldn't be compromised, because they belong into the vulnerable group. So I think the strategy for us would be in terms of comprehensive response, as I said earlier on, inclusion of everybody else, no one being left behind as participating, and making sure that within the decision-making structures, it evolves. We have provinces, we involve provinces, and provinces as well would have the similar operational structures that we have at national, and that's how we are making sure that we are involving everyone in terms of our strategy and in terms of the response. We have a country-based HIV and AIDS response strategy that is very comprehensive. It's got communication lines, it's got various sectors that what needs to be done even in terms of your workplace. So that's what it works for us, and I think it's something that we could be able to say it can be replicated. Thanks.
Thank you for that. To the Right Honourable Helen Clark, if I can ask for your thoughts in terms of finding ways that we can do this better.
Better. And I'd like to pick up a couple of points. One, the impact of the pandemic on those living with HIV. The director of the Africa CDC in his video mentioned the disruption of services. And sadly, that did mean testing's disrupted, delivery of HIV treatments is disrupted. This disruption was also a factor, of course, for women and children around sexual and reproductive health and rights services as well. But I understand the evidence from intensive care units in sub-Saharan Africa shows that HIV is associated with almost double the odds of dying from COVID-19. And it is so important that in planning for effective pandemic response, that the plans incorporate protecting everyone with pre-existing conditions, including by ensuring continued access to essential medications. So building that resilience into healthcare systems so that essential services can go on is extremely important. Now, how to do better in future? Our panel made quite a number of recommendations. One, and again learning from the HIV response, is you have to keep leaders, heads of state and government, focused on this challenge. It's so easy when a pandemic kind of rolls away and we go back to some kind of new normality to forget about the need to invest in preparedness. Unfortunately, if you don't learn the lessons of history, you will repeat them time and time again at great cost to your people. So this preparedness message has to be driven home hard. We have recommended that the General Assembly have a special session, just as HIV had its major special session in 2001 at head of state and government level, and that heads of state and government at that session should agree on a political declaration on a reform program moving forward to support the global effort for better preparedness. We're proposing that part of the reform effort be the formation of a global council, a health threats council, which would have heads of state and government on it, and that their job would be to provide monitoring and oversight and accountability to see that countries do and organisations do live up to the preparedness challenge. We call on World Health Organization to set out a clear roadmap, benchmark targets for countries to be able to measure their performance against, and for a universal periodic review mechanism facilitated by WHO to see how progress is coming along. We've also recommended that there be a pandemic financing facility with an ability to pay formula to fund for it, because low and middle income countries need support on an ongoing basis to get preparedness right. That needs solidarity funding. We're talking global public goods here. We're only as strong as the weakest link in the chain. We can't afford to have any country fail on preparedness, but we're going to have to support that. And then when a pandemic threat emerges, you need surge financing in order to be able to respond to that threat. And again, that can be funded by the special mechanism we suggest with the surge funding facility. So we've made a number of structural recommendations and also recommendations about target setting and monitoring with WHO. We very much want WHO to be strengthened. We feel that it needs to be further empowered. Its funding, of course, needs improvement. We're confident that a future pandemic can be averted, but not if we muddle on the way the world was muddling on when COVID-19 blindsided it.
Before I move on to our next panelist response, if I may, one of the challenges that has been highlighted in some feedback opportunities and reports is this notion of countries who were initially assumed to have been well prepared for an emergency response. When the response time came, they were proved to be ill prepared. And in fact, a number of countries who had previously dealt with Ebola and the like, such as the DRC, were actually able to take their learnings from those crises to apply those to COVID-19. The assumption many may make is that some of these countries who are assumed to be well ready have a lot to teach. To what extent do we need to ensure that the opportunity and the sharing of information goes both ways?
Oh, yes, you make a very good point. You know, the Johns Hopkins and colleagues assessment of who was the most prepared put the United States at number 1 and the United Kingdom at number 2. sadly, in that 2020 year, neither had particularly effective responses. My own country was rated 35th, and yet New Zealand is thought to have had one of the best responses in the world. So there were things that definitely weren't being measured in those kind of matrices. And you're right, the countries, the high-income countries, could learn quite a lot from low and middle-income countries who had experienced pandemic threats before. Not just threats, it had to deal with them. I mean, when I was UNDP administrator, we saw the agony of the 3 West African countries struggling with Ebola. But a lot of lessons were learned in that, which were able to be applied when this came along. Similarly, the SARS experience in East Asia left East Asia much more sensitized to what needed to happen to avert a pandemic running out of control. So we need to bring all these learnings together. It's not just sort of, the North knowing it all and sharing it with the South. No. This is a South-North conveying of experiences as well. And really, the income level of the country had very little relationship to the nature of the response. It was really who was onto it, who had a plan, who had capacities, who'd had experience, who had leadership that was prepared to act. That was an incredibly important factor. Look, I do recommend go to our independent panel website. We have a marvellous report there, the 28-country study on a range of responses, and it draws out the common factors which contributed to either a more successful response or a less successful one.
Thank you very much. If I can then come to Violetta, unfortunately, I'd just like to note that Gail Smith has had to step away. She's not able to stay with us for the remainder of this discussion, but I am able to go to Violetta. One of the comments that was made from the floor, Violetta, was this notion of using or better using technology, particularly in communities that may be more vulnerable, to assist them in accessing solutions and accessing better management tools should they find themselves in a position where they are vulnerable to a pandemic such as COVID-19 or something like HIV/AIDS. I'd like to hear your views on to what extent you believe that is actually doable in some of our more vulnerable communities.
Well, it is very doable in a certain level because we people with HIV in Bolivia, for example, we are asking the national government to implement these remote consults with the doctors that take care of us. But we also know that many people with HIV don't have this. They don't have a phone. They don't have a smartphone. They cannot pay data. And for them, we need to use the old system. We need to bring the medications to them. We need to use delivery systems, and the government has to pay for it. I think more than the technology, which is something that we have to do, we also need to expand the provision of HIV services to the rural areas and to specifically those that are very rich to high to reach, and those that are not going to be able to get an appointment using a phone. Many of my colleagues living with HIV don't have a phone that can support that kind of care. So we need to think about those communities as well. And I know in the region there are many poor in Latin America and in the world, many people with HIV who are so poor that cannot even eat these days, because of the pandemic. So even thinking of a phone is like a dream of New Year.
It's interesting that when you say that, because when one looks at low and middle income countries, very often it is also a question of infrastructure, which many in developed countries take for granted. Just getting access, having people physically be able to reach those who are living with HIV or those who are dealing with COVID-19 in remote or more rural communities is in and of itself a huge challenge, which countries also need to address, presumably, as they try to figure out how to respond.
Definitely. And I think if a government knows well which are the people who are getting HIV, and we have information on this. UNAIDS has a lot of research on who are the most vulnerable to HIV. So we know what kind of persons are getting HIV and who are the most affected. We don't have to invent everything now. There is a lot of research in HIV, operational research that can help us improving our services. It is very clear that HIV is associated with people who are less privileged economically, who are not close to the services, and also the access problems in the big cities, like, for example, Buenos Aires in Argentina, which is a country that doesn't even receive money from the Global Fund. And you would say, okay, Argentina is doing fine with HIV. No, there are many places in Argentina, in Buenos Aires, that don't have any access for people who are living with HIV. There are also very poor people there. Many of people from my country, Bolivia, they migrate to Argentina in order to have a better life, and then they get access to the medications for HIV. So if a country knows who are the people getting exposed to HIV, then the services can be well adapted. But generally, the services are very generally made, and they are not made with specific considerations for those people who are in the margins of society. And think about those people that are moving in the region. Mexicans are moving, people from Central America are moving in Latin America. Migrants, where are they going to get care? In which country? Who is responsible for them? Or do they have to carry their own medications? There is a huge challenge in Latin America now with people who are on the move and their access to treatment. Let me just mention the need of Venezuelans. They are moving inside the region, and they need all of us, all member states and ministries of health to take care of them.
Thank you very much for that. Minister, if I can then perhaps come to you. One of the challenges that Violeta has just mentioned is this notion of being sure, having some level of certainty around who is the most vulnerable, where they are, and how better to get to them.
I just missed you saying who are the vulnerable.
Who the vulnerable are, how to get to them, is one of the points that Violeta has just made in terms of trying to find better and more workable solutions, particularly for vulnerable communities.
No, definitely. I think one of the things, and I listened to the last panel where it was focusing on women. Women becomes the most vulnerable in terms of communities. If we look in terms of South Africa, the history of it, women has been, triple oppression that we talk about in terms of always being left behind. They are found in the most informal in terms of the workplace, with unequal pay compared to their male counterparts, with the burden of household. And therefore, because of those positions, they become the most vulnerable. Young people as well. But also, when we look at globally, you find the queer community are also the vulnerable. So most, even those who are in the most remote areas, earlier we spoke about the remote areas, rural areas, where within urban you have access to facilities. For example, if I have to take medication, access to the infrastructure in terms of primary health care facilities for me to be able to access my medication in terms of HIV, including TB, which becomes some of the issues when you have to deal with issues around HIV and AIDS. So those becomes, especially those in remote areas and rural areas, becomes the most vulnerable. And therefore, how you have to be able to deal with them, as I said earlier on, is that country by country, you've got to be able to look at your own infrastructure in these remote areas. One, make sure that you have facilities, but partner with relevant stakeholders. Because if we look in communities in remote areas, you'd find either people would have some religious or faith-based organizations in those communities, whether they are in the most remote areas or within our continent. For example, you'd find even the traditional leaders within those remote areas and utilize them as a partner to be able to give them access, utilize them, because most of the time these are the people that you find them to be influential in this community. So that's why when you do your plan, when you do your strategy, it's always important to be able to incorporate that into the discussion so that you don't leave behind. There would be issues around even those who are illiterate in communities, because the barrier of language, where you find sometimes we utilize, let's say in communities where people do not utilize a major language, let's say in South Africa, you find that there are various indigenous languages. So you've got to be able to ensure that you can translate to the languages that the people can understand, that they speak in those. So those who do not have the means in terms of education becomes as well the most vulnerable, that you've got to be able to translate what you provide as interventions for them to be able to buy into your interventions, because they've got to be able to understand comfortably in that.
Thank you very much, Minister. To all our panelists, thank you so much for your enlightening insights, for your inputs, and for your remarks. I think they certainly will go a long way to helping us find solutions that can better help us in the future. Mr. Chair, I'd like to give the floor back to you. Thank you.
Большое вам спасибо, уважаемые делегаты. Благодарю глубоко уважаемых панелистов, делегатов за очень сильные и актуальные вопросы. Особенно благодарю госпожу Туми Макхаба за энергию, которую она привнесла в эту дискуссию. Участниками были упомянуты важнейшие элементы страновых и глобальных противоэпидемических мер, применяемых в это время неопределенности. Была отмечена важность сохранения доступности услуг по ВИЧ и обеспечения непрерывности лечения пациентов. Особенно была выделена роль неправительственных организаций и волонтеров, сыгравших во многих странах важнейшую роль, в том числе в доставке антиретровирусной терапии в условиях карантина. Подчеркнута необходимость укрепления взаимодействия государства и частного сектора, а также международной кооперации. Коронавирусный кризис вызвал шоковую реакцию, чем спровоцировал определенный ответ мирового сообщества, попытку предугадать возникновение новых инфекционных и неинфекционных угроз. Тем не менее, этот подход не самый эффективный. Сработает последовательное укрепление и усиление системы здравоохранения. Так, один из ключевых уроков данных нам пандемии COVID-19 — это то, что мы должны располагать резервами. В формате готовых к развертыванию либо перепрофилированию в кратчайшие сроки систем в здравоохранении, науке и фарминдустрии. В будущем мы должны выстраивать устойчивые, сильные системы здравоохранения посредством интегрирования услуг, укрепления первичной медико-санитарной помощи, подготовки сильных специалистов, поддержки научных разработок, принятия взвешенных политических решений на основе научно доказанных данных и проведения анализа экономической эффективности. В этом контексте повышается роль профилактики. Она становится высокоэффективным подходом, который снижает нагрузку на системы здравоохранения и позволяет сохранять наши драгоценные ресурсы. В данном отношении на первое место выходит работа по треку вакцинации. Сегодня получены и опубликованы убедительные данные по безопасности и эффективности вакцин. В частности, на векторной платформе. Обеспечение их доступности является приоритетом нашей работы. В отношении COVID-19 это стало реальным благодаря всеобщим усилиям людей науки. Открытые Открытие вакцины от ВИЧ также должно стать приоритетом работы экспертного сообщества. Именно эти задачи буквально вчера в Москве обсуждали участники глобальной вирусологической сети GVN, организации, которая объединила ведущих мировых вирусологов. Успехи в разработке вакцины от COVID-19 позволили нам вернуть надежду на создание вакцины от ВИЧ, что становится нашей амбициозной, но достижимой общемировой целью. Уважаемые делегаты, все тематические сессии объявляются закрытыми. Надеемся встретиться с вами вновь через 2 часа, чтобы подвести итоги прошедшего совещания высокого уровня Генеральной Ассамблеи ООН по ВИЧ-СПИДу. Благодарю за внимание. Спасибо большое.